in this definition, the functional capacity of the mouth is covered, and as well as its impacts in the psychosocial aspects. So you can see that, okay, how this pain might limit an individual's ability to bite, chew, which addresses the functional part that the mouth is used for, and then the psychosocial part, the confidence of a person to smile, how they will socialize, speaking, and other aspect of their psychosocial well-being. And so this basically captures what we are talking about when we say oral health. Now, why does oral health matter? Oral health is not separate from general health. I remember how in school my lecturer would usually say that, as a dentist in training that time, I would say that, oh, it is not a tooth that walks into the clinic, it's actually a person. So it's important to see as oral health promoters that, when we are saying oral health, we're not just saying, okay, it's just about the mouth and it starts and ends in the mouth. It's actually not separate from general health. Poor oral health can lead to heart diseases, diabetes, respiratory problems, poor nutrition, poor quality of life. There have been studies that have shown the relationship between oral health and these diseases, particularly for diabetes, for example, as an example. There's something that we say that when we talk about oral health and diabetes, that it's a bi-directional relationship. That is, oral health, if the oral health is poor, it has its way of limiting how the blood sugar can actually be controlled. And at the same time, when there is also high blood sugar, like there is the tendency for more inflammation, for more diseases to happen in the mouth. Speaking about poor nutrition, for example, think about someone that does not have teeth to chew, or someone that is in pain. That such persons would limit how they would eat. It is the pain that they are concerned about, and it's not even, what will I actually eat that will benefit my body at that point. So oral health is actually related to these things. It would interest you that there are actually also studies that relate poor oral health to adverse outcomes in pregnancy. So, for example, there have been studies that show that when there is poor oral health, in a pregnant woman, that there is a tendency for that woman to give birth to a child that is preterm, or has a low birth weight. And so I'm just painting all these pictures so that we can see that oral health is actually quite vast, and it is connected to the rest of the body. Okay, so before we go on, I just want us to quickly type in the chat box what oral diseases we have seen in our environment. Please, you can use the chat box. Okay, so someone says, okay, Yano says dental caries. Damilare says fluorosis. Elizabeth says scurvy. Vanessa says swollen gums. We are all on track. So it means that we've been observant, right? It means that we are familiar to some extent with these oral diseases. So let's start with this most common one, dental caries. Holes in tooth, dental cavities. When we go for oral health outreaches, especially when you are in an environment that is like a community, you would not go ahead and be saying dental caries. Like, it's more of a professional term. So you'd rather use, something like tooth holes, dental cavities, right? And this is usually caused by an interaction such that when the microorganisms in the mouth act on sugar, they break it down and form acid, which at the end of the day breaks down the tooth structure. So one of the common oral diseases that we find is dental caries. Another one that we find is periodontitis. Some people might call this gum disease. Some people might call it gum swelling. And so, first of all, I think we can see this yellowish accumulations on the surface of this tooth, right? So it is called calculus. Some people also call it tartar. And so little by little, it starts with what we would call plaque. It's like a sticky film. And over time, it gets hardened to become these yellowish accumulations. And little by little, it starts to, trigger reactions around these gums that are surrounding the teeth. Before you know it, maybe if it progresses, the person can begin to experience loose tooth because of these accumulations. Also, the person can begin to experience bad breath. So these are also things that you would find in relation to periodontitis. Now, another common oral disease that we would find, this one, you might not have heard it as much, but actually there have been cases of oral cancers. So you can see something that is like an ulcer around the tongue of this picture that is painted here. So oral cancer, mouth cancer, tooth loss, also called edentulism. It is also an oral disease. You know, some people have this mindset that, oh, okay, well, as I'm aging, it is just right for my tooth to begin to fall off. But at the end of the day, it's actually still an oral disease, because if we take care of the teeth well, if we take care of our mouth well, right, we should not end up losing our teeth. Okay, so another common oral disease is halitosis. That's the medical term for bad breath. So it can actually stand alone. Remember that I said that when we're talking about periodontitis, about those accumulations that, you know, when they begin to build up in the mouth, they can be a source of bad breath. But then at the same time too, bad breath is actually vast. Sometimes it's the cause is not directly from even the mouth. Sometimes it can be from another disease that is happening somewhere else in the body. Now, another common oral disease is tooth wear lesions. Tooth wear lesions. So one of the tooth wear lesion is dental erosion, and one common thing that causes dental erosion are acidic drinks. So, for example, your regular lime, if a person takes it consistently, I mean, it is acidic. Before you know, it begins to wear off the surfaces of the teeth. If you can see the second picture here, where it looks as though the neck of the teeth have been chopped off, that one we will call it cervical abrasion. It's also a form of teeth wear, of tooth wear lesion, and that is commonly caused by when a person uses hard toothbrush. So these are some of the common oral diseases. And then we'd also talk about cold sores or herpes. Now, some of us might be familiar with this picture. You would find that maybe regularly some people, when they have this, they'll say, okay, it means that malaria is coming. It means that I'm about to have malaria, and you know, they link it directly to malaria. But then it is actually caused by a virus, herpes simplex virus. So it is called herpes or cold sores. All right, so we are done with the first module, and I want us to quickly get into the second module. As we go on, please, if you have questions, I want you to take them down. When we have the break session, I would take our questions. All right, so we are currently in the second module, and in this second module, we'll be addressing oral hygiene and preventive dentistry. That is things that we can do to prevent oral diseases and maintain our oral health. Now, what is oral hygiene? Oral hygiene, you know, includes your daily practice of keeping the mouth, the teeth, and gums clean and free from disease through brushing and flossing. Now, this picture demonstrates the proper tooth brushing. You would agree with me that more often than not, the brushing technique that we commonly use, you know, the brushing techniques that, okay, this is how maybe your mom, this is how maybe your dad, or what, maybe it's even an elderly sibling that used to brush you when you're listening, you know, this is what you were taught. And most commonly, you know, people do the left, right, horizontal pattern of brushing. But today we are seeing that, you know, in this first picture, it says place the brush at a 45-degree angle to the front tooth surface, and the bristles must contact both lines of tooth and gum. So the bristles should actually be angulated at 45-degree. Part of it should touch your gums, and part of it should actually touch the tooth. Now, what do you do next? You move the toothbrush in a circular motion. you move it in a circular motion. One thing that is missing from this part is that after you've done a circular motion, you also do a sweeping motion. I'm going to show us a video as a form of demonstration very soon. Then for the third part, you can see that, to clean the inside surface, you have to tilt your toothbrush vertically. That's particularly for the front teeth. You have to tilt your toothbrush vertically. And then to clean the inside surface of also the lower front teeth, you have to also tilt your toothbrush vertically. If you are probably not been to a dental clinic or had somebody, train you on this, I'm sure that, would not exactly be brushing this way. And I can share with you that even myself, it was until we were taught this in dental school that I knew that, oh, okay, I actually have been brushing wrong all my life, right? I mean, that's why we are here, so that we can learn and we can also teach others the right thing to do. So, if you are with me, please give a thumbs up. All right. Now, let us look at some oral hygiene aids. So we are aware that there is the use of toothbrush. Now, what toothbrush do we usually recommend that people use? We say that people should use medium textured toothbrush. That's for adults. A medium textured, or you can call it a medium bristled toothbrush. While for children, we would say that they should use a soft bristled toothbrush. Hard toothbrush is a no-go area. Hard toothbrush, I'll say it again, it is a no-go area. It causes more damage, it causes more harm than good, right? So if there is that mindset that, oh, the harder I scrub, the better or the cleaner my teeth becomes, please, that is not what we are doing at all. So medium bristle toothbrush for adults and then soft bristle toothbrush for children. Now, for toothpaste, the toothpaste that you would usually recommend to people, because people would ask you, what is the right toothpaste, or what is the best toothpaste that you are recommending? And what you simply have to just tell people is that, a toothpaste that has fluoride in it is actually good enough for you. So we're not necessarily recommending or looking for one particular brand. Just check the ingredient section, check the pack of the toothpaste, check the body of the toothpaste, and just look at it. Oh, does it contain fluoride? And fine, if it does, that is good for you. Now, let me also specify at this time that as regards the toothpaste use, the portion that we put on our toothbrush, a pea-sized amount is enough. I sort of find it funny that, in maybe all these TV adverts where they are advertising, you would see them spread toothpaste on the old brush. Like, you don't need that. You don't need that. We're helping you save your money, and at the same time, we're teaching you that this is the right way to go. You just need a pea-sized amount, right? Something like a granite size, and that is enough to actually do your toothbrushing. So you need two things. That's the pea-sized amount of toothpaste, right? And then the right pattern of brushing. It would effectively clean your teeth. Now, for children, like those that are still in like their preschool years, like children about 3 years below, those that that when you tell them to spit out after brushing, they will not spit out after brushing. They're going to swallow everything. So we would usually say they should just use a rice smear. So a rice smear is basically like the size of a rice grain, right? Another thing that we also use is dental floss as an oral hygiene aid. Now, toothbrushing does the 60% part of oral hygiene. Now, without that, you would not be cleaning your teeth completely. And so that's why flossing has to come in place, because there are places that is in between your teeth that your toothbrush cannot get to. So you have like floss picks, and then you have the floss that is just this thread that does not have the pick. So what is expected of us, brush twice daily, right? In the morning and at night before we go to bed. And for the flossing, once daily is enough. Now, for the proper flossing technique, I want us to look at this. So this is for the one that is not the floss pick, because there are actually some floss that is just this thread. So you basically just cut from it, roll it across your fingers. It says take about 50 centimeters of floss, wind most of the floss around each middle finger, holding the floss tautly between your thumbs and index fingers. Slide it gently between your teeth. Never snap the floss onto the gums. Gently curve the floss around the base of one tooth. Use an up and down motion, making sure you go beneath the gum line. Gently curve the floss around the other tooth and use the same technique. So be also sure to floss at the back surfaces of the last molars. So quickly, we're going to move into the demonstration of proper tooth brushing and flossing. So let's have a look at this. All right, so I believe we all got that. Please give me a thumbs up. All right, so very quickly, I want us to look at flossing. All right, so that's it as regards flossing. And I can confess to you that before I also thought that, oh, when you are using floss, you should just put it in between your teeth and then bring it out. Like just do straight motion, put it in, bring it out, put it in, bring it out. But you can see that they had to actually make a curve motion, and that was when the plaque could come off well. All right, so quickly, we are going to look at the importance of fluoride. So when we are saying look for fluoride in your toothpaste, look for fluoride in your toothpaste, what exactly is the whole fuss about concerning fluoride? So these are some of the benefits, one of which is that fluoride strengthens the tooth. So when we say that fluoride strengthens the tooth, like it's a mineral, right? So it binds to the tooth and makes it more resistant to breakdown by acid. So fluoride actually strengthens the tooth. And definitely when the fluoride, becomes a component part of the tooth crystals, of the tooth structures, and strengthens the tooth, obviously caries is going to be prevented. By caries, I already mentioned that is tooth hole. Also, fluoride has an antibacterial effect. Now, this is not to say that fluoride functions as though it is an antiseptic, but look at it through the lens that it can reduce the rate at which microorganisms break down sugars to produce acid. Also, it repairs early tooth decays, and obviously, at the end of the day, the oral health is maintained. Now, what are some oral hygiene misconceptions? I already spoke about this. One is brushing hard makes the teeth cleaner. I don't want to speak too much on that. I've already, elaborated on that. The second one now is bleeding gums are normal. Bleeding gums are not normal. I mean, we would not look at maybe our finger now. It should just start bleeding, and you'll not be like, what exactly is going on? Obviously, your body is reacting, so it is not normal that the gum should be bleeding, right? Now, another misconception is that baby teeth brush do not need brushing. Now, this is something that one can softly tilt towards and just think that it should actually make sense that baby teeth should not need brushing, because at the end of the day, it's not just going to fall off and there'll still be a permanent one. So who cares about baby teeth? But see, I want you to know that nature knows what it's doing when it puts baby teeth and then it puts permanent teeth, right? We cannot be wiser than God. Like, there is a reason why there is baby teeth, where there are baby teeth, and there's a reason why there are adult teeth. So for example, let's say a child should, lose their milk teeth, their baby teeth before time. There is a tendency that, when the permanent ones are coming up, when they are erupting into the mouth, they can erupt into another position. Why? Because the baby teeth are supposed to serve as a guide, as a pathway that, okay, yes, so this one that is growing under, this is where it should actually come out. But imagine that, okay, everything has just removed, like there will just be anarchy. Do you get? So another misconception when it comes to oral health, some people say that if there is no pain, there is no need to visit the dentist. And it is not so. It is not so. It is not so. We know, I mean, one of the things that Oral Health Africa Initiative advocates for is actually prevention, right? So you need an expert to say, to actually let you know that, oh, okay, there is nothing wrong actually. And at the same time, so just what if, a disease is starting early, and if a prompt intervention is done, it can actually be abated. So obviously, it is important to visit the dentist, right? Even doctors, for general body checkup, it's usually important that we go for checkup, whether it's oral, whether it's, general body checkup, right? So that we can be sure that, okay, everything is fine. Now, another thing is that flossing is only needed to remove food debris. Now, we might fall into this trap to thinking that, okay, what flossing does 100% is to replace what toothpick does. Because what people used to speak for, people used to speak that, okay, maybe a meat that they were eating has gotten stuck into their teeth and they want to remove it, right? People now use floss because we've already told them that using toothpick is going to spoil your teeth, right? It's going to spoil your gums. But then again, while flossing can actually remove food debris, one thing again is that flossing would actually dislodge, right? It's going to dislodge plaques that are forming on the surfaces of the teeth. It's going to, sort of disorganize their colony. By plaque, again, I'm saying that it's that sticky film that when it now gets hardened, becomes those yellowish accumulations on the teeth. Another misconception, pregnant women should avoid dentists, skip brushing when gum is bleeding, and that white teeth are always healthy. Because of time, I think I will just go to the third module. So what we covered under oral hygiene and preventive dentistry is, I mean, is 100%. It gives you a general scope of what that entails. So very quickly, we are in module 3, and module 3 covers community oral health education. Now, what is health education? Health education refers to the process of providing individuals and communities with knowledge, skills, and motivation to improve their health. Know that there is an end goal when you are doing oral health education. Oral health education is not to come and show somebody. Maybe you Oral Health Africa Initiative has sent us out to go and do a particular outreach somewhere, and you want to go and show that, oh, you guys, actually, I just finished one oral health promotion course. Let me come and download, let me come and tell you everything, in the old lingo, or in the old jargon, that, okay, this is what oral health is, and we're just there to pass information. And we're not seeing the aspect of, oh, when we actually give knowledge, is to the point that, okay, people can actually be motivated to improve their oral health, right? So we have to be conscious of that. So, for example, when I was talking about tooth holes. So maybe OHAI says that you should go to a particular place and go and educate them about tooth holes. Now, we will not go there, especially considering the environments that you have been sent to. So maybe it's a community that you have been sent to. You will not go there to go and be saying, so dental caries is a multifactorial disease. It's a post-eruptive disease that, like, we can't go and be blowing English, blowing grammar, right? You want to break it down and meet people where they are. So health education goes beyond giving information. It targets behavioral change. And I want us to actually take this home, that it targets behavioral change. So you need to look at whatever health education that you're giving through the lens of this, that, oh, you want to target a behavioral change. It's of no use if we have just come to shout and pour out, whatever we want to say, and there is no there is no change, and people are still where they are, or they do not understand what we have told them, right? So it targets behavioral change and empowers people to make informed decisions. Look at it, it says informed decisions. So I am not coming to say that, do this thing because I said that I should do it. You would, for example, we just looked at the importance of fluoride in module 2. So look at it from the concept of, maybe I just go to a place and I'll tell them, okay, so make sure your toothpaste, you should be using fluoride. And they don't even know what you're using fluoride for, what its effect is, what it will do, compared to when you actually give them the benefit. And so the person can now take an informed decision that, oh, okay, me, I actually also want this benefit. And so I should adhere to whatever these people are telling me, right? So what are some communication skills for health promotion? Like I rightly said, clear and simple language. You need to meet people where they are. You need to meet people where they are. Maybe, for example, you are sent to maybe where children are. In dental practice, even for us as professionals, if it's a child oral health clinic, see, there are times that you dance, you move your body because you are still trying to make the child get comfortable with you. Else, child just be crying before you know it. Maybe you say just be crying that even you don't know what to do, right? So you need to understand your audience. You need to meet your audience where they are. You need to speak to them in clear and simple language, right? Maybe for a child that grew up in an urban environment that has exposure, right, to basic amenities, and you're trying to maybe relate some things, and you can begin to say, okay, so brush well, like PJ Masks does. I mean, if you don't know PJ Masks, sorry about that. I'm just trying to use an example of a cartoon that maybe someone in the urban center might know of, and someone that grew up in a rural center might not know of. So you have to know what exactly you are saying to whoever your audience is. So pay attention to what people say, their concerns and culture. You need to pay attention to that. What are the beliefs in this place that I have come to? Okay, is it that this place that we have come to, they don't see any need to use something like toothpaste, right? If you don't know if you don't know what the beliefs are, you will not know what to actually target, right? one more skill again that we need is respect and empathy, right? So we need to respect the people that we are seeing in outreaches. We need to respect people that we are seeing when we give oral health promotion. Don't just, have the lens where you're just like, anyways, like you had better listen. I'm actually the one doing you good. Like you need to give people their dignity. You also need to have empathy, right? Don't just look at a child with poor oral hygiene and just be like, Shay, your mommy is not brushing for you at home. Abi, your dad is not brushing for you at home. Like, don't let someone else go feeling less than how they came, right? So we need to actually have empathy when we are giving, oral health talks. Like I already said, to cultural sensitivity, non-verbal communication. Also, maintain eye contact, pay attention to the tone of your voice. Also, persuasion. Like I said, you can begin to give them, oh, these are the benefits of this particular thing. If you are there to it, you need to motivate them. You need to use appropriate media. So, for example, let's say the oral promotion we want to do is in an urban center where you know that they don't used to use radio, and you now going to choose, okay, radio slots or radio time, that okay, is true radio, you want to give your own oral health promotion. Like, it will not work, right? We need to use appropriate media. Maybe for a rural setting you can say, okay, well, there are farmers, there are tillers, there are etc. like that, right? That you regularly use radios, that regularly use this form of media. So let us tailor our approach to meeting them by the use of appropriate media. Another thing is also, feedback, and another skill is consistency. Now, let me open up this consistency part. So it is not necessarily to say that when we have gone for an oral health outreach in a particular location, that maybe we would have to now keep going there like every week, every week, every week. Fine. Let's say that's the scope of the outreach. That's all well and good. But then again, there are also mediums, there are methods through which we can actually ensure that there is consistency in whatever communication that we have done for our oral health promotion. So what forms are there? So for example, we can go with posters, right? We can go with maybe tracts that we paste, maybe it's the wall of a school, such that, oh, the things that we said, the scope of what we covered, even after we are gone, there is still something, right, that is speaking to these people. Another medium could be that maybe, for example, in a school, you can just establish an oral health club. Oh, that you have already trained these people, you have spoken to them, there is an oral health prefect. I'm just saying, I'm just like giving us examples of how consistency can be enforced. So you know that, okay, oral health clubs have been established in this place. We've given them the oral health promotion. Oh, they usually have meetings every week, so they are going to be the ones, still telling their classmates, telling their fellow school colleagues what we have actually said. So there are actually ways we can ensure consistency. How to deliver oral health education, community assessments. Like I said, know the oral health problems, know the oral health problems, the local belief and literacy. Engage community leaders. Obviously, like if you're going to a community and there are people that they submit to, there are people that are leaders in that community. If you want to do an outreach that is seamless and you don't want issues, obviously you need to engage the community leaders. And again, it would make more sense when compared to you that is distant from a people and you are giving them oral health information. Imagine that, oh, it is now their leader, their community leader that you have informed, that you have done oral health promotion for, that is now telling them. They know that leader. They would likely believe that leader more than you. Do you understand? Another thing is choose appropriate teaching method, whether for children, demonstrate, carry, suit model, storytelling, songs. Use teaching aids like posters, models, local materials. Focus on key preventive messages and leverage existing community structures like schools, markets. So maybe I should just speak to this particular part that says leverage existing community structures. So maybe we want to do something mega, right? You compared to maybe gathering people, maybe in your advert you put, okay, this is the particular location that I want all the people in this community to gather. Why not think of strategic places that you know that whether or not you were even around in the first place, they are already gathered there. So, for example, we can tell that, okay, through schools, we would do this oral health promotion, through markets, we do this oral health promotion. All right, so that will be all for module 3. I want us to put in the comment section, just type something that would make somebody somewhere know that you are actually in an oral health promotion course. Type something, maybe brush twice daily. Just type something in the comments or in the chat box rather, to just show that you are following, and that can make someone know that you are currently in this course. So far, we have looked at introduction to oral health. We have looked at oral hygiene. We have looked at community oral health education. So we can see that we are actually building up, right? So now we'll be taking module 4. And what module 4 covers is basic dental screening. So I want us to imagine, picture that we are currently going for an oral health outreach, and we would need to look into people's mouth, examine their faces, check if there are any diseases. So what are some of the basic things that we would need? I want us to put it in the chat box. What are some of the things that we would need if you want to examine, if you want to check if there are oral diseases amongst the people that we are reaching out to? Iyanu Oyejide. Iyanu Oyejide, we should give you your dental degree, right? Iyanu Oyejide, please, are you a dentist? I'm expecting your reply, Iyanu. Oh, we would know. We would know. It's the mouth mirror, mouth mirror. I didn't want Daniel to say mouth mirror. Please, other people that are not in the dental profession at all, please, I want you to put in the chat box some of the regular things we would need.
By their responses, you shall know them.
Exactly. Mr. Damilare, are you one of us? We can keep the responses coming. Are we going to dip our hands into patients' mouths like that? Okay, beautiful. Someone says, Daniel says gloves. I think I will stop taking responses. Air, water, syringe. This is we're already opening clinical. Okay, face mask. Beautiful. So, well done. Thank you very much for the responses. Definitely, we can actually have all these things that you have listed, right? We can have them, right? But then, they're also like more common ones that we would tend to regularly use, face mask, holding spatula, gloves, definitely too. If provision is made for explorer, made for periodontal probe, etc., like that, we would also use them, right? So, what is oral screening? Oral screening is a quick and simple examination of the mouth in order to identify diseases in individuals who may not have symptoms. So, it's possible that you are at an outreach venue and someone tells you that, oh, I don't need oral health, I don't need oral screening. Nothing is wrong with me. You can always admonish the person that, oh, it doesn't hurt. No fee is required of you, just to examine your mother, just to be sure that, oh, everything is fine, right? Because sometimes you might not have symptoms, but then there is actually a disease. So now, why does it matter? It matters for early detection of oral diseases, to reduce oral complications. So definitely, when a disease is caught on time, caught early enough, oral complications can be reduced, to raise awareness of oral diseases. So maybe, for example, there's a community, maybe from the water that they've all been drinking, all of them, their teeth is now white. They have fluorosis. if nobody is checking, all of them, let's say they've not moved out from that community, they'll just think that it's normal now. All of us in this community our teeth are white like that. So if no screening is conducted, right, they will not know that okay, this particular disease is in this particular area. To also plan community programs and for surveillance. So surveillance is like taking record, monitoring the health of a population, analyzing their data, and it's to the end that you can make an informed public health decision. Okay, so where is oral screening done? So aside the dental clinic, screening can be done in schools, outreaches, primary health care centers, workplace, be it markets, offices, wherever, religious gatherings. Now, how to conduct oral screening? I mean, light is different of anybody that wants to conduct oral screening. Because I mean, look at it, you are looking into a hollow, right? Except for the face that, okay, fine, you can outrightly sort of still see. But then into the mouth, you definitely need a place to be well illuminated. So the environment should be well illuminated as regards instruments, the mirror, as some of us have stated, spatula, gauze, for infection control, you can talk about mask, gloves, and sanitizers. Definitely the instrument should be clean. And for positioning, you sit at eye level. So you can ask brief questions, right? Ask the person, do you have pain, any swelling, any bleeding? Some people, they might give you a response that, oh, yes, there is, and even points to the particular place that they're experiencing these symptoms from. Some people, they don't have any symptoms, so you would just end up checking, right, to find if there are any issues. Check the face. Remember that in our definition in the first module of oral health, we talked about not just the mouth, but we said orofacial. So you also need to check the face and then the oral cavity for lesions, for if there are caries, for periodontal diseases. Now, examples of oral lesions include, you can see there is an ulcer here. For this first picture, it's a patient that has a swelling. So that's for one of the aspects. I mean, there are different oral diseases that concerns the face, right? From infection to the one that is from trauma, etc. I mean, it's broad. But then something I want us to take home as volunteers is this, especially if there are people on this call that are not dental, that are not in the dental field, right? Now, this is not to tell us that we should go and be diagnosing. That's not the point. What we are trying to do is that, okay, be able to identify. Nobody is placing that onus on us. I mean, that's a burden. That's a burden, right? That is not backed up by any regulatory body. So nobody's asking us to go out and be diagnosing, right? But we just need to be able to spot, oh, there is something unusual here, and be able to just describe it. Okay, there is a swelling, you document it. There is an ulcer, right? You put it down. This first picture shows an oral white lesion. You can just document, oh, white lesion on the roof of the mouth. I mean, for us, we'll say that it's on the palace, right? But nobody needs your big English, right? So you can just put, okay, on the roof of the mouth, oral white lesions on the roof of the mouth. This one, there are red lesions on the cheek, the lining surface of the mouth, bleeding gums, poor oral hygiene on the tongue. For this one, there is a little bump on the surface of the tongue. You can also see tooth holes here. Here also we have some lesions too on the floor of the mouth. You can see white patches. You can see like a reddish bump too on this floor of the mouth. You can also see the roof of the mouth there that is called the palate. So what I'm trying to basically pass across to us is that we are not putting, a burden that is too hard for you to bear. We're not saying that you should begin to diagnose diseases, right? We're just saying that be able to identify that, oh, there is a deviation from the normal, and just be able to describe that and put it into writing. So record the findings, right? Provide basic education, and definitely for people that you can see that, oh, there are issues, there are oral diseases, appropriately refer, okay, nearest dental clinic, put it down and refer such a person. So that's it for module 3, module 4 rather. We are progressing. Module 5, who is excited? Gradually, we're almost coming to the end of this session. If you're excited, please let me see your reactions. Beautiful. So now, interestingly, my slide went to module 1. Okay, let's fix that. All right. I hope we can all see how we are sort of building in a stepwise manner, right? Again, we started from introduction to oral health. We looked at oral hygiene and preventive dentistry, community oral health education, and then we've talked about oral screening. And now we're going to be looking at recording, reporting, and referrals. Somebody type RRR. Looks like Remita. So we're looking at recording, reporting, referrals. I love the energy. Well done. So now I want you to picture this. Imagine that a lot of money have been invested into maybe a particular outreach. We have said that, okay, this is the place that we are going to, and then we've gone there. Maybe it was a garage now that was the outreach venue, and we've done all the screening, we have done all the examination, we have done all the oral health talk, and then we shall just came home. And someone now ask you that, okay, what did you go and do in the outreach? Give us a feedback, give us a report. And you just go, well, we went to the garage, we screened people, we did oral health talk for them, we did this and did that, right? But then you're not giving statistics. You're not saying these are the number of males, these are the number of females, these are the prevalence. By prevalent, I mean like, okay, these are the diseases that they actually have. I mean, we can't go far as an organization, right? If we do not record, if we do not report, right? Because we need to have the numbers to even be able to measure that, okay, this is what we're actually doing, right? To be able to say, okay, we might need more resources to be channeled to this particular area. So recording, reporting, and eventually referrals are actually important. So now recording a community screening program involves collection of participants' data, examination results, and follow-up actions to ensure safety. Can be done using electronic or paper-based records. So I know that a number of us are familiar with what's it called now, Google Doc, right? So it's one of the things that you can use as an electronic method to collect data, or paper-based. So maybe it's a questionnaire rather that people are filling in. So reporting of a community screening is a systematic process of documenting, analyzing, and communicating the results of health screening outside clinical setting. So I'll just take that again. Recording a community screening program involves collection of participant data, examination results, and follow-up actions to ensure safety. It can be done using electronic or paper-based records. Whereas for reporting, of a community screening is a systematic process of documenting, analyzing, and communicating results of health screening outside clinical setting. So why does it matter? It facilitates care and referrals. When you have your findings documented, you can be able to say, okay, maybe there are particular diseases that were encountered that do not fall within the scope of the outreach that you went for, right? You can know that, okay, let's refer rather, let's refer appropriately so that this person can have the care that they should actually have. It also helps for us to identify high risk communities. Again, imagine that we just examine people, and maybe you're saying that, oh, maybe you're like a robot that you feel like in your head you are going to remember everything. It will not work that way, right? You need to have things documented such that, okay, when things are not analyzed, you can be able to say that, oh, in this community, it's dental caries. In this community, it is tooth loss. In this region, it is fluorosis. In this region, it is that. It can also help us to, it can also inform public health action. So, okay, when you already have results, right, you have findings from an outreach and intervention, he can be able to bring it forth such that, okay, actions can now be taken that can address this thing as a population, not just as an individual. It can also help to inform allocation of resources. And this is one of the points when we talk about program planning, such that, okay, you already have your findings. So you already know, okay, this is where funding should go to. It's like doing analysis. You're like, okay, well, where do I want to direct more of my money to in this time? Is it to invest in myself? Is it to build my education? That kind of thing. I mean, I digress a bit. So it helps us to inform allocation of resources. You know where to send your money to, right? It also informs policy change and health equity. So what are the components of community screening records? To identify key information, create a data collection tool. For example, I said it can be electronic, right? It can also be manual. Ensure consent, right? At the end of the day, see, one thing you should know as a volunteer is that people have the right to say no, right? You can't force anything on anybody. So ensure that they consent to whatever you are doing, right? So that nobody will come and sue you. So that HR will not, they will not say that they don't know you from anywhere. So ensure that you take consent, right? Designate trained personnel. So you will see that more often than not, especially for programs where interventions are needed, at least OHI would usually send someone that is a dental professional there, right? So that's what this point covers. Ensure data security, not such that nothing is lost, evaluate data and follow up. So what are the components of community screening? Reporting. For the background, the purpose of the outreach, all these things are important, right? You don't just say you're going for an outreach and just go. Like, they have to be all these details. So that will be included eventually in the reporting aspect. So purpose of the outreach, this is the target population, the location, the dates. Okay, for the method, these are the screening tools. Okay, maybe it was questionnaires that we employed, all those things like that, team composition, data collection tools. Then the results. Okay, what's the total number screened, the age, the sex. Okay, maybe some diseases are more common in a particular age group that you found out, or some diseases are more common in a particular gender that you found out, risk factors, and then referrals. Then for the discussion aspects, you interpret the findings, compare available data, identify gaps, and eventually for recommendation, because you shouldn't actually just stop with coming to the end of an outreach that, okay, fine, we already have data. At the end of the day, it should be to the end that, okay, something can actually be influenced such that there can be a change in the population at large. So maybe, for example, presenting it to Ministry of Health, or maybe bodies that are involved in policy change that can address the issues that you have found out. Health education strategies, where the resources should be allocated, and then follow up. And then conclusion, summarize the findings and the impact of the program. And for the community feedback, you share results with community leaders, let them also know. And like I rightly said, you share with the policy makers. So for referrals during community screening, in community screening, referral ensures that an individual with suspected problem is properly evaluated and managed at an appropriate facility. And it must be ensured that no participant is lost in the process. And this does not only speak to those that we are referring, but to everybody that we are screening. So, like, just like that example I was giving, that maybe if you go to a garage for an outreach, you should be able to say that, okay, these are the total number of people that we reached out to, like, ensure that nobody is lost in the process. Okay, so what are the components of a good referral? The participants' details, their name, age, gender, right? What are the screening findings? So, like I said, you can just give a description of what you have seen, the reason for the referral, the name of the referring hospital, referring doctor's identity, and then follow-up and documentation. All right, so that's module 5. And we're about to go into the last module. I want you to, just clap for yourself if you have come this far. Just use the clapping emoji. It's not easy. You spent data, right? And even your time. Okay, so for the last module, we're going to be looking at oral health and vulnerable groups. Oral health and vulnerable groups. So when we say vulnerable groups, we're referring to that proportion of the population that tend to experience, poor health outcome, maybe due to their biology, maybe due to an economic reason or an environmental reason that they are disadvantaged at, right? So that covers the scope of vulnerable groups, that aspect of population, right, that experience poor health outcomes due to their biological makeup, social, economic, environmental disadvantages. And that's what we're going to be looking at. So oral health, as by way of introduction, oral health is not merely the absence of disease, but a state of functional, psychological, and social well-being. Unfortunately, this state is not equally experienced across populations. Certain groups called vulnerable groups bear a disproportionate burden of oral diseases due to social, economic, biological, or environmental disadvantages. So when we say vulnerable groups, who are the people that we are referring to? We're referring to children, for example. Um, I believe you would all agree with me. I mean, children are part of the vulnerable groups because, as an example, um, a child will not know they should be brushing their mouth. For example, if they don't have, an elderly person, a parent, a caregiver that actually instructs or teaches them to. If a child grows up in a place that nobody is brushing, the child is not going to be brushing. For pregnant women, hormones, progesterone, estrogen, all of them, messes up sort of um, with their gums, with their oral health, right? So they are part of the vulnerable groups. For the elderly, a reason we can say is, for example, some elderly people, maybe because they're already using some medications like antihypertensive, antipsychotics, etc., like that, they tend to have dry mouth. For some elderly people, they have lost teeth, etc., like that. People living with disabilities, for some people, they don't have the manual dexterity. By manual dexterity, I mean that, okay, you say that brush twice daily. Now, they can't even hold a toothbrush properly because of the disability. They fall within the vulnerable groups. For low income or rural dwellers, refugees, marginalized people, all these people that I've mentioned fall within the vulnerable groups. All right, so for oral health challenges in vulnerable groups, we'll just look at that quickly. For children, their risk of caries, limited parental awareness, and definitely if the parents doesn't know what they should know concerning the oral health of whether even themselves or their children, it is what they know, right or wrong, that they're still going to instill and teach their children. So we can see here limited parental awareness, maybe also they have limited fluoride, maybe they don't use fluoridated toothpaste, right, etc., like that. For the elderly people, like I mentioned earlier, tooth loss, difficulty maintaining oral hygiene. Same way, I was talking about for some people that have disabilities that they might not be able to handle their toothbrush well. There are some elderly people too that are already losing their manual dexterity too and might find it difficult in maintaining their oral hygiene. For some people, it's the use of multiple medications that also has its toll on oral health. So, for example, there are some medications, like I mentioned earlier, that can cause reduced salivation. And when there's reduced salivation, there is more likelihood that, tooth holes, dental caries would form, because part of the things that your saliva does is a cleansing action. It can wash off whatever food substances or sugary things that are in your mouth, right? It also has like this buffering action. So if we are, I don't know if everybody are science students, if you know your pH scale, right? So saliva falls within that neutral range, right? So if a person has a good salivary flow, it would at least have its own role in preventing oral dental caries rather. For pregnant women, increased gum disease due to hormonal changes, limited awareness during pregnancy. For people living with disability, physical and intellectual challenges, dependence on caregivers, poor health access. For refugees and internally displaced persons, poor living conditions, limited access to clean water. I mean, some people are living this way, right? There are people with chronic diseases that also have increased risk of periodontal disease. So by chronic disease, I'm saying, for example, something like diabetes, right? These kind of people will have increased risk of periodontal diseases. So why is this subject actually important? One of the reasons is that they are high risk individuals. And if they are high risk individuals, it means that we should actually pay attention to them, because they are more likely to have oral diseases. And we must ensure that these people are seen as part of the population. I mean, one of the SDGs, right, Sustainable Development Goals, I think that would be SDG 10. It addresses reducing inequalities. So this particular model sort of covers that, because you want to reduce inequality as regards the oral health of these individuals. They should be able to have equal access to care, right? So like I was mentioning, they are high risk individuals, they have limited access to care, oral disease are more severe and untreated. Also, like I mentioned, it's an important discussion because you want to reduce health inequality and also to support universal health coverage. And this still addresses health inequality in its way. So, what are the strategies to improve oral health among vulnerable groups? One of the things is that we can do targeted community health education. So we can just come down and say that, okay, this is maybe let me find one of the groups, maybe pregnant women, which I just decided that, okay, we are going to antenatal clinic for oral health outreach. You need to do a targeted community health education if we are going to, improve the oral health of these vulnerable groups. Another thing is that we can do community preventive intervention. So, for example, the use of fluoride varnish to prevent caries, right? So, for example, maybe it's a community that they rarely have access to fluoridated toothpaste. They can just be a plan that, okay, let's go with our own fluoride varnish. At least they will have protection for some months, and then maybe plans can be made for that to be done consistently, right? So community preventive intervention, the use of fluoride varnish, also screening, because when you screen, you can find out, okay, this is the prevalent disease in this particular group, and you can know what intervention to target, right, for that group. Also, you can improve care access. So obviously, one of the challenges with oral health in Nigeria particularly is that some people do not have access to care as regards their oral health. For some people, maybe their nearest dental clinic, they will have to take maybe like 2 transports, or the money that they will spend to even get to that clinic, they would rather use it to eat. So one of the things is that, okay, if they can't go to the place, then the place can go to them, if you understand what I'm saying. So a medium is, through outreach. So, those people, we can plan outreaches for them, meet them where they are, so that there is improved care access. Another thing is, policy. So, for example, just imagine, won't it be beautiful if maybe in Nigeria there's a policy that covers
people living with disabilities that they must always, I'm just saying that they must always have like a long life supply of related toothpaste. Like at least maybe the caregivers will be like, okay, there is a supply of this, so maybe to make it easier for them. Or um, let's say for pregnant women, maybe there's a policy already in Nigeria, oral health policy, that states that um, for all the antenatal clinics in Nigeria, there must be oral health education for them. I mean, oh God, I don't know if we know, like, I feel like pregnant women are one of the people that if you say you want to combat oral diseases, pregnant women are the people that should actually I mean, you know that I'm not saying one is greater than the other, but think about it. You are instructing a mother who would probably be a mother to more than one. If she knows, she can pass it down to the child, right? If the child knows, the child that is informed can pass it to another person. Like, I mean, it's such an A game outreach, if you ask me. So imagine like that, those kind of policies, right? So oral diseases will be reduced amongst them, and also community participation. And with that, we have come to the end of this oral health promotion course. Uh,
Wow,
Miss
wow, wow,
Femi,
wow, 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 wow. Amazing. Amazing, 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 amazing. Please, if your hands are not too busy, kindly give our trainer a round of applause. Thank you so much, Dr. Comfort. Thank you so much. Thank you so much. Thank you so much. That was so insightful and very relatable. I'm sure our participants have gained a lot. So before we go into our assessment in the next minute, I need one person to just give a one or two actually to give a quick recap of what they have learned so far. A very quick recap, a very quick recap.